My name is Ivan Kramer. I'm 60 years old. 4 years ago, I started having symptoms which are related to my stomach, and I went to the doctors, and unfortunately each time I was given a diagnosis that it's this problem for the regurgitation or for the bloating or for the reflux, and given pills and sent away, and the problem continued, in fact got worse until about a year ago, where I started regurgitating in the evening and choking, started losing weight. I was feeling terrible in my stomach all the time. Felt like even pressure on my heart. I decided to go and see a specialist. After some tests, I was diagnosed with a disease called achalasia, and they proposed to do a helimyotomy operation on my stomach. I didn't feel comfortable with this operation, although I realized that I needed to do something to get this thing solved, and decided to go for a second opinion. My son met a gastric surgeon on the plane going to watch the FIFA World Cup in Qatar, and he suggested that I don't do that operation, I do a home surgery. He would recommend to Dr. Farooq. We did all the tests again and reconfirmed the achalasia. We decided to go ahead with the home surgery, and on the 17th of July, I had the operation.
Hi, I'm Dr. Farooq Khan. I'm one of the Consultant Hepatologist and Interventional Endoscopist here at King's College, Dubai. When Ivan came with the symptoms were very classic of dysphagia, and I think one of the problems with this disease paradigm is that not many people, including professionals, wouldn't understand. Mostly patients will present with regurgitation or a heartburn, which then slowly leads to difficulty eating or swallowing food.
I had the operation. Within a week, I could feel some changes. I could feel that the food, which was getting blocked up inside my esophagus before, was actually starting to release into my stomach. It's now 6 weeks since post-operation. It's definitely been a success. I'm able to eat the foods I like now. I've gone from liquids onto solids, and almost eating everything as normal.
We are very, very fortunate now that we have brought what we call POEM, which is peroral endoscopic myotomy. It's done endoscopically, it's minimally invasive, there's no surgery or scars, and it takes us about 40 minutes to 1 hour to do it, which we're doing here at King's Dubai. The other most important thing is we also become the first center in Dubai to use a special device called EndoFlip. It's a very safe, minimally invasive procedure. Usually patients stay overnight and then go home next day. They remain on liquid diet for a few days, followed by soft diet, followed by very normal diet. And it is very, very reassuring to see that our patients really taking back control of their life with fairly minimal interventions, from a bigger surgeries to a very small endoscopic procedure, which has helped their life-changing event.
I'd like to thank Dr. Farooq for doing this operation on me, and he spent a few extra hours in surgery on it to make sure it was a success, and I'm very happy with the outcome. Thank you very much.